All right, welcome back, everybody, to the Citrus Today Show. Dr. Matt Lasorsa is joining us on the program today. Glad to have you here.
Thank you, Dennis.
Many of our viewers have seen a little infomercial that you do on this station, but we wanted to have you in on the program and talk a little bit more about this unique product that you have in our area and how it can help people out. For those viewers in the audience, share a little bit about your background and education.
Okay, I'm originally from Massachusetts. I went to UMass Amherst for undergrad. I went to Tufts University Dental School. I graduated in 1998, and I originally came to Florida to do a one-year residency at the VA hospital in Gainesville. And like most people from New England, once I got down here, I decided I wasn't going to leave.
You enjoyed the weather, yeah.
Exactly. So I lived in Gainesville for a few years, and then we eventually moved to Dunellen, which we still have a place in Dunellen. And now my wife and I, my wife's a dentist also. She's a graduate of University of Florida Dental School. We practice out of Citrus Hills Dental here in Hernando.
Very good. Well, the products that you have brought with you today are kind of unique. You were telling me beforehand that this has been around since the 70s, I guess, but really has caught on in the after the millennial, after year 2000. More and more people using these products. And just kind of briefly describe one of these. We'll start with whichever one you want to.
Okay. We can start with the denture option, which is what most people come in for. We're going to talk about, these are called mini implants or mini dental implants. They were developed for what I use them for people that don't have either enough bone or don't have a medical history to get conventional or standard size implants, or they just can't afford them. Okay, these are a lot cheaper, a lot easier to place, and a lot less maintenance. So that's what people come in for. We'll start with the denture model. And I always start with a lower denture because anybody who's been wearing dentures really doesn't like a lower denture. There's not much to hold it in.
Right.
It gives them teeth, it gives them something to bite with, but they're not very functional. So this model shows 4 of the mini implants. That's what we need on the bottom because the bone's very dense up here. And we modify either your existing denture or make a new denture for you that has these, we call them housings. They're like little O-ring snaps inside there. And if you notice on the top of the mini implant, there's a ball. And the ball will snap into the housing like this, and that's what holds it down. Now, if somebody comes in with a pretty good denture, a pretty well-made denture on the lower, I can usually do all this in one day. I can place these 4 implants, get the lab to retrofit their denture, and within a couple hours, they can walk out and go have lunch, okay?
Wow.
We can do the same thing on the top. The top can be a little more challenging because the bone's a little softer, so I need more implants there. And also, a lot of times we have to make a new denture because to get the housings and the implants to have enough thickness in the denture, a lot of times their existing denture just won't work. So they can wear their denture as a temporary, but either way, we can place the implants in one day, put a liner in their denture to get it to fit, and it works the same way. Now, if you notice the upper denture, it doesn't have a palate. And people see this model and they want that palate out on day one. I don't usually do that on day one. I'll wait till it heals, I'll wait till they're comfortable with it, and then we can start horseshoeing out their denture and they don't have to have a palate there anymore.
How long does the process actually of inserting the little, I call them posts, into the bone itself?
Just a few minutes really, once I get started. That's the easy part. The placement is the easy part. I call the lab procedure retrofitting the denture. That's what takes the time. That's the hard part.
And this is with dentures that they currently have?
Most of the time.
Very, very interesting. And you do the top, the bottom, as we'll get into. You also do some partials, not the complete. But what's the advantage to the patient of having this versus just say dentures that they've been used to, that they're using now?
Okay, so you're saying without implants?
Without implants,
okay.
Yes.
They don't have to use any adhesive because they snap in. Putting an implant in there will maintain the bone you have. If the bone has something to stimulate it, like a natural tooth, the bone won't shrink, it won't resorb. They wear these 23 out of 24 hours. They don't have to take them out at night. It's recommended that they keep them in at night. They just pop them out once or twice a day to clean them and pop them right back in. they're a lot more functional. They can bite into apples and corn on the cob and steak and everything they couldn't do with just conventional dentures.
So you're back to what feels like your original dentures.
What feels like your
that
real
you
bite.
have, your
Exactly.
real bite. What do you clean these with?
Just soap and water.
Soap and water.
Soap and water is the best thing.
Okay. I'm amazed that you do all this in a one-day period, not every single case, but in most cases, and it's so quick, it's easy. The process was available in the 70s, but why didn't it take off until really here in the last few years?
Well, there's been a lot of changes in the implants themselves. Like any new process, it goes through a lot of changes, a lot of upgrades. Now the way they're designing the implants to adhere to the bone right away, we know a little bit about how much load the bone can take and how many implants we need to balance their bite or to absorb the forces. So now they've pretty much got it down to a science. This is what we can do in one day, and this is what it'll absorb. So it's become a lot more popular now because, of course, at first there's a lot of disbelief, and there's still a lot of disbelief. But I've done thousands of them at this point, and I really haven't had too many problems with them. So it's pretty effective.
Remarkable. And one of the questions that everybody has when they start any kind of dental procedure or medical procedure is the cost factor. Is it an expensive project?
Well, I'm not going to say it's cheap, but it is much more affordable than going to a conventional style implant or going to, you see some advertisements for teeth in a day. That can be done, but it's probably 4, 5, 6 times the cost of doing something that's just as effective.
Okay. I want to talk a little bit more about that and how easy it is to get it financed and whatnot as we continue. So stay with us, everybody. We'll be right back with more on Citrus Today after this. All right, welcome back again to Citrus Today. Again, Dr. Matt Lasorsa is with us, and we're talking about I say unique process, but it's been around for a while, of implants and taking existing dentures in many cases and adapting them to your mouth and to the implants that you're putting in, which takes only minutes, really. I'm amazed at that. You also, for somebody who has 1 tooth or 3 teeth missing, you have a way to solve that problem as well, right?
We do. This is a model of that. This is a crown restored with a mini implant. If there was 1 tooth missing in the front, it's usually in the anterior region, the front region that we use the minis. It's just 2 components. It's the implant, and then we have the crown made at the lab, and that gets cemented in, and that's permanent. Now, when the patient comes in, we put the implant in one day. They're going to leave with a tooth, but it's going to be a temporary tooth. It's something we make chairside.
Right.
We'll take an impression for that, and it takes a couple weeks for the permanent one to come back, and that gets cemented in. But they do leave with a tooth that day. And we can do that if there's multiple teeth missing as well. I need a few more of them, obviously, but I can put 3 or 4 of them together and make a fixed bridge that would get cemented in as well, and that's permanent.
And that's permanent also.
That's permanent.
Very easy way to solve a problem. A lot of people, as you mentioned, they may be missing a tooth up front, and it's a little distracting from appearance-wise, and it's a great way to solve that. What's the difference between implanting 1 or a few teeth and a bridge or some type of work that's done to put something in there?
You're saying what's the difference between 1 and several, or you?
I know there are some processes where they fuse the 1 missing tooth together with the other teeth that are there, and that probably carries its own difficulties with it.
Exactly. A bridge is just what it sounds like. It's 3 or 4 or 5 or many crowns fused together, and you fit that on existing teeth. The benefit of implants is we don't have to grind down those adjacent teeth to fit crowns on them to make a bridge. If you notice this would stand independently. In the old days, you'd have to grind on this tooth, make a bridge to go all the way across and cement it here and here. Now here's the disadvantage. If something happens to this tooth or this tooth, we have to start over.
You have to start all over again, yeah.
Versus this is independent if we don't have to touch your adjacent teeth.
Very good. We mentioned that it's affordable. You do have financing available in some cases, interest-free, I understand.
There are some interest-free options, and there's options of 6 months or a year or 2 years or whatever they're more comfortable with.
Very good. Now you've got these other models back here. This is for somebody who's looking for something a little different than the first models that you showed to us.
This is a step up. This model here, as I told you before the show, this is my personal favorite. This is called the Fixed on 6, which it's just a catchy name, the Fixed on 6.
Right.
It's 6 to 8 of these mini implants. I like to go with 8 as a rule, just so we have some extra support. And this is a milled porcelain bridge, okay? And it has the same O-rings as in the denture. It gets snapped on, but the patient can't remove it. So that to the patient, this is permanent. This is fixed. I would have the patient come in 2 or 3 times a year for cleanings, and I would remove this, allow the hygienist to clean and inspect around the implants, and then simply pop it back on for them. And
what is the implant itself made out of?
It's a titanium alloy. So it was discovered by mistake years ago in I think Germany or Austria that titanium adheres to bone. So now they've like I said before, when they've developed the implants, they make a roughened surface, they make the threads so they cut through the bone rather than scrape, and that allows the bone to adhere very quickly. It grows right to it.
And you actually have a process, we were discussing this earlier, to help improve or fortify the bone structure if that's needed, right?
Well, that was the grafting procedure I was telling you about, that if somebody comes in and they need multiple extractions before they go to a denture, before they go to implants, we have a procedure where we have a phlebotomist come in and actually draw the patient's own blood, and there's a machine, it's called a centrifuge, that spins out the growth factors within their blood, the stem cells and enzymes within their own blood, and that we implant that into the extraction sites, and that stimulates your body to grow bone. Grow bone, it's a concentrated signal to grow bone right there. And what that does is, if we're taking out a lot of teeth, what'll happen without teeth there, it's just like if you have your arm in a cast, it'll atrophy. If the bone doesn't have stimulation, it starts to shrink, and then it makes it a little more difficult to place the implants in. If we stimulate the bone to grow very quickly and within a few months, it's very sturdy, we have a nice platform, a nice ridge to place our implants in and maintain their bone.
Very good. And the last model here, I don't want to neglect that one.
Okay. This is the Cadillac, okay? We nicknamed this one the Roundhouse.
Got it.
I need 10 or 12 of these implants to do this. These would go all around their arch. It's supported all the way around. And again, this is another milled porcelain bridge. And this would get cemented permanently, similar to the models I showed up here. And that wouldn't come back out. That's as natural as we can get. I'll show you that.
Because of the number of implants makes it even sturdier, right?
Yes, we get what we call cross-arch stabilization, meaning they support each other, so it's very sturdy.
It's an interesting process indeed. And you mentioned you've done thousands of these in your practice. Something that if you're going to have a procedure like this done, you want to have somebody who has done a lot of them, because experience has taught you many things. We were discussing, in fact, one of those little things. I asked you about this particular model. I said, well, because this is up top, it looks to me as if that would trap some food particles underneath. You learned that you can also seal that with a procedure also, right?
Right. Like I explained, I would have the lab technician put a ridge around there, so it puts a little more pressure on the tissue right around that seal, and that effectively seals it so that you can't get food trapped underneath it.
And again, Dr. Lasorsa is right here local at the clinic there in Citrus Hills.
Citrus Hills Dental.
Citrus Hills Dental is who you want to call. And I'm sure there's more questions than what I was able to cover this morning, but we want to thank you for spending some time with us.
I want to thank you for having me.
And thank you folks also for joining us on this edition of Citrus Today.